In 1888, when the Daniel A. Jones Memorial Building cornerstone was set in place, the memory of the Great Chicago Fire was less than 20 years old. In that brief time after the fire, the city's population had exploded from 500,000 to 1 million people.
In 1871, after the Great Chicago Fire destroyed the Rush Medical College campus in town, the Rush Medical College faculty and trustees chose to move to the west side to be near Cook County Hospital at Wood and Harrison. And this was a time period when a lot of medical schools offered only course-based education, lectures, and Rush Medical College faculty thought it was really important for students to actually get experience with patients, clinical experience.
The raging medical controversy of the day was how diseases were spread. During the 1870s, the groundbreaking work of Louis Pasteur, Robert Koch, and Joseph Lister proved that specific germs cause disease and infections. But medical beliefs were slow to change. For a typical surgical operation in the early 1880s, surgeons wore their street clothes. Many doctors in the United States, including some at Rush, still pushed the miasma theory, a belief not illogical that diseases were caused by bad air.
So while it still took some time for germ theory to gain complete acceptance, there were certainly Rush Medical College faculty members who realized the cause and effect between sanitary conditions and the outcome of their patients. So for example, Dr. Moses Gunn, who was a Rush surgeon and professor, stated in the 1880s, "I don't know much about the truth or falsity of the statements concerning bacteria, but I do know that if I wash my hands and wash my patient and my instruments and use carbolic acid and iodoform, I can accomplish results that I never dreamed of 15 years ago."
By the late 1880s, antiseptic surgical techniques became the norm. Sterile gowns appeared, as well as the use of boiled rubber gloves for surgery. Fortunately for patients, anesthesia had been around in various forms for the past several decades. Unfortunately, proper dosing was still an evolving art, and death to the patient could and did result.
In 1883, Rush Medical College trustees and faculty developed a teaching hospital, Presbyterian Hospital, with the support of local Presbyterian congregations. And they quickly outgrew those first buildings, so they opened Daniel A. Jones Memorial Building in 1888.
From the earliest years of the hospital, local churches would endow beds for $300 annually, so that poor patients need not worry about payment.
Another kind of sponsored bed were called cheer-up beds. So these were beds in the children's ward, and they were sponsored by local Sunday schools. And this tradition continued on for several decades and provided free care to thousands of sick children over those years.
Rush medical students at the time were a mixed bunch. Some of the older ones had been druggists, salesmen, and even cowboys. One day, when the learned Dr. Henry M. Lyman entered his lecture, he found a mess of thrown spitballs, shoes, snowballs, and apples. Disgusted, Lyman walked out and the lecture was canceled. Nowadays, lectures are a bit more orderly. By the time a small copper box was embedded in the cornerstone of the 5-story laboratory known as Sen Hall in 1902, the existence of different blood groups had only been known for 1 year.
The building's namesake was Dr. Nicholas Sen. He was an attending surgeon at Presbyterian Hospital and also on the surgical faculty for Rush Medical College. He was instrumental in raising the standards for admission to the school. He was really interested in an affiliation with the University of Chicago in the 1890s. And for the University of Chicago to agree to this affiliation, Rush Medical College would need to build a new facility to accommodate the influx of new students. And he contributed $50,000 of his own money. The University of Chicago and Rush Medical College were affiliated from 1898 until 1941.
A year before Sen Hall opened, the Chicago Tribune reported the humorous moment as Dr. Sen applied mortar to the cornerstone containing the time capsule. "Bring a scalpel," called a student in the crowd as the trowel was seen to tremble awkwardly, in striking contrast to the habitual steadiness of the operating knife in Dr. Sen's grasp. "Pass the doctor the artery forceps," echoed another, and then cheer after cheer broke out from the student ranks for their beloved leader. The growing patient population outpaced the output of trained nurses provided by the Illinois Training School for Nurses. So the school urged Presbyterian Hospital to develop its own nursing school. So in 1903, a year after Sen's doors opened, M. Helena McMillan founded the Presbyterian Hospital School of Nursing. McMillan, whose father persuaded her to not pursue a doctor's career, was described as a generous, determined woman with a good sense of humor, all traits embodied by Rush nurses over a century later. In the earliest years of the school, Miss McMillan pioneered innovations that other schools adopted decades later. She was among the first to require a high school diploma for entry into the program. Presbyterian Hospital was committed to utilizing the latest medical technology. Its 1904 annual report proudly displayed photos and engravings of the latest high-tech medical devices of the day, including the Tesla coil and tubes used for high-frequency electrotherapy, and, quote, the most complete X-ray laboratory in the West, unquote, the X-ray having been discovered just 9 years earlier.
In 1912, Presbyterian Hospital opened the Jane Murdoch Memorial Building for Women and Children. And this building replaced the two oldest buildings on Presbyterian Hospital's campus. And it also continued the connection, the physical connection between the Jones Building and Rush Medical College's building.
The Rawson Memorial Building opened in 1924 and marked the beginning of a new contract between Rush Medical College and the University of Chicago, which had been affiliated since 1898. Rawson provided state-of-the-art laboratory facilities to accommodate this new agreement and an influx of students. As the years passed, Chicago grew and Rush grew. Every new addition to the Rush campus resulted in important advances in patient care and continued excellence in healthcare. The hands that placed various objects in these rough-hewn boxes over a century ago were the hands of people just like us. People with a commitment and passion for improving the lives of countless individuals and communities, now and into the future.